So let us continue the Nash Therapeutics study streak for 29th May, and we have been discussing some interesting remedies so far. Uh, Magnesiums, natrums, magnesiums, and then Baraitacab from Dr. Nash's Leaders in Homeopathic Therapeutics. And today we'll take up something that Dr. Nash gives after Baraitacab, which is again dependent, or rather the body has an important dependence on this element, and which is iodine. So how does Dr. Nash see this particular remedy, and what are his experiences? Let us go and understand. We'll discuss two remedies. One is iodine and another is bromium. Both are opposites of each other, which is what Dr. Nash calls as iodum, one of the top anti-scrofulous remedies as mentioned by Dr. Nash, and all that we see in different materia medicas. Scrofulous diathesis, low cachectic conditions, profound debility, great emaciation. This is the first point Dr. Nash mentions. And he goes on mentioning 10 important points. If you grasp these 10 important points, then you are in a better position to prescribe iodum rather than going over 10 different materia medicas. So it's important to understand what Dr. Nash wants to say, and how does he wants us to understand iodum as a remedy. The sense of weakness, number 2, Dr. Nash mentions the sense of weakness is profuse, loss of breath on going upstairs. Ravenous hunger, eats often and much, loses flesh. This is the third point. Number 4, and which is very important, and if you want to confirm number 4 in the patient, you can get it very easily, or they will tell you directly by themselves. They feel better while eating or better after eating. They'll keep on eating, and they'll feel better while eating or after eating. Next point Dr. Nash mentions is there is dwindling of mammae and soreness. So you see an emaciated person, it can be a young adult, it can be a middle-aged person who has shrunken body or shrunken mass in places where it should be. Iodine can be one of the remedies that can be thought. So based upon observation itself, you will be able to decide the remedies, and it should click in your mind at that time. Dr. Nash says that iodine is also one of the top remedies for profuse uterine hemorrhage and CA of uterus. He goes on to tell us that chronic leukorrhea, if it is abundant and corrosive, iodine is one of the remedies we can think of. And swelling of the glands. Now you can see that all the glands which are external are shrunken in size, whereas all the glands that are internal have increased in size. So there is swelling of the mesenteric and the thyroid glands. And you can see that membranous croup, it's a disease which was seen or labeled in the 1900s for a type of presentation of URTI symptoms: wheezing, sawing, drying, barking, cough, and a person, or especially a child who is dark hair, dark eyes, and he grasps the throat with the hand while coughing. This is the description of iodine cough by Dr. Nash. And the patient feels aggravation in the warm room. So these are the 10 points Dr. Nash gives. And then he concludes the iodine remedy by telling us that hunger better by eating is progressive, with progressive emaciation is of the first importance. All the patients will have this symptom. We need to observe it. There is rapid metabolism, which we see, catabolism rather, we would say, to be more specific. And whatever be the disease name, if it is having this particular pathophysiology, hunger better by eating and progressive emaciation and lot of weakness, iodine is bound to cure. Next, he gives us very short case in 2 lines, and this is the specialty of Dr. Nash. In many remedies, he gives cases which are short boosters for us to get inspired. He tells us that iodine in CM potency, one powder every night for 4 nights was given in a case of goiter. After the full moon waned, the remedy helped cure the patient. So he tells that this remedy is of prime importance. He has not failed in many cases. He has given iodine CM potency in cases of goiter. And if you want to succeed in homeopathic practice, this is one of the techniques which he lays out for us to give on the basis of moon phases. Boger has explored that very well in his book and his cases. We can go over that maybe sometime in future. But this is what Dr. Nash tells us from his experience about iodine in case of goiter. Next is the remedy which is bromium, very similar remedy. And he starts off by telling that element which is proved and arranged by Herring. It is an important remedy for laryngeal affections and scrofulous and tuberculous affections of the glands is seen. So why Nash gives us just the brief points in his book is because these are the clinically important points. Whenever patient appears in front of us in our clinics or we go to visit them, we will just see these salient features in the patient. There is no beating around the bush like we see in many materia medicas about the description, about the stories, about the themes. Just something that is clinically relevant is mentioned by Dr. Nash. And if you are not reading this book, which is a very small book, then you are missing out on something which is very valuable. So lay your hands on this book, and the remedy next we are discussing after iodine is bromium. It acts on persons with light blue eyes. Over there we saw dark eyes and dark hair. Over here it is flaxen hair, which is a blonde kind of. Light eyebrows, delicate skin, and red cheek scrofulous girls. And you can see that opposite temperament of iodine is mentioned by Dr. Nash himself. And he then goes on to tell us that there are top 3 remedies he considers for all the glandular affections. So anywhere in the body that you see patient reporting to you with symptoms of glands, affections of the glands, carboanimalis, conium, and bromium need to be thought. All three have stony hardness of the glands with cancerous tendency. Conium and carboanimalis have lancinating, cutting, burning, cancer-like pains. But bromium is the only remedy amongst the three which does not have any pain. So once you keep this image in mind about the description of pain of the glandular affections by the patient, it's a very quick analysis and you do not need to search in any materia medica or repertories or see any literature. Just these salient features and you are through to the prescription of the remedy. Next is something which is very valuable, and if Dr. Nash gives it for certain disease named as diphtheria, which is now not existent, but the characteristics of bromium are very well existent in front of us, which is an upward action in cases of diphtheria which he saw. Now, how do we see this in current age? Patients will report to us with cold, cough, upper respiratory tract infections. They will tell that first there was difficulty in breathing, cough, and then the nasal discharge started. This is the upward tendency of symptoms. Bromium can be one of the remedies thought of. I have usually prescribed also sepia, Merck Sol in such cases with good success. He gives in such cases of diphtheria where there was downward action, first the nasal passage and then the chest affections, Lyco was prescribed by him. But there are many remedies having this type of nature of starting from the nose and going through the chest. If you see, bromium has one of the characteristic symptoms, which is upward action of the respiratory affections. If you remember this, whether it is common cold, cough, upper respiratory tract, lower respiratory tract affections, or thyroid related affections or glandular affections, if it has this characteristic, which is upward action of the symptoms like sepia, like Merxol, think of bromium also, and also the other two remedies that I mentioned. Last but not the least, Dr. Nash tells us that in membranous croup, which was a disease we saw in the 1900s, all the homeopaths saw, there is great rattling of mucus like hepar, but there is no expectoration. So you can almost feel that the patient has, rattling like entemtard. There is no sleepiness. The patient is very much well awake, aroused, and responding well, moving well, eating well, sleeping well. But there is no dullness. Bromium is one of the remedies that can be thought. So last but not the least, Dr. Nash tells us that accumulation of mucus in the larynx is bromium, whereas accumulation of mucus in the bronchi is antemtar. These are beautiful, finer differentiations of bromium with the other remedies which Dr. Nash mentions in just half a page, or quarter page, or less than one page of documentation in his book Leaders in Homeopathic Therapeutics. And if you are a homeopath who want to progress your practice, build your practice, after Allen's keynotes, Boric Materia Medica, MM Tyler, this is the book that you need to touch. Leaders in Homeopathic Therapeutics by Dr. Nash. And this initiative I have taken up to make everyone aware of this interesting book, and not to neglect amidst the new authors that have come up. Go back to old sources, touch your old sources, and you will be enlightened much more in a better, uh, you know, knowledge than ever before. So that's all from me right now, from Homeo Setu initiative to help you all improve your practice, and something more is slated to be announced very soon. Stay tuned and keep following us so that you can be well aware of the developments from us for the progress of homeopathy.